the question that was called in was from a young lady apparently who has numbness and tingling in both of her hands. She just had a baby. The tingling hasn't gone away. Numbness and tingling during pregnancy is not uncommon. It often resolves after birth when water weight is lost. Not always is it resolved. So let's presume that there is several months afterwards and she's just not getting better. Tell us what resources you have at the, say she comes to your clinic first, and then how you would process that patient, because it's fairly typical. And then, if needed, what referrals would you do if you couldn't manage it there?
So, and you're right, that's a fairly common kind of issue. Much of the time after pregnancy, that relates to pressure on the median nerve, what we call carpal tunnel syndrome. And the first thing is to simply do an evaluation and see how bad it is. Carpal tunnel can be anything from a relatively minor annoyance in which wearing a splint fixes the problem, to damage to the nerve that actually causes atrophy and wasting of the muscles in the hand, which would require a much more urgent fix. So in that setting, we do the initial evaluation and decide where along that spectrum we are and what we need to do. There are several possibilities, anywhere from immediate referral to a hand surgeon, to sending to a neurologist to have a nerve conduction study done.
Which is a test that you can, by the way, the neurologist at Boice-Willis Clinic is truly the best that I've seen in 25 years that I've worked.
What's the physician's name, neurologist?
You asked me too quick because with an M.
We'll get it.
Yes.
Yeah, we'll get it.
Phenomenal studies, impressively accurate. Complementing with a perfect physical examination, you could take his studies to the bank, which is something that I've depended on. It's a study that I use as a hand surgeon quite regularly, and a very impressive, high quality provider you have there. But he's in your walls. He
Yes.
works with you, and so if you need this elegant study, you can get him to do it.
Yes.
And then you can respond to that and refer within your system or out of your system.
Correct.
But most times you could probably treat it in-house without referring out.
Exactly. Most of the time, carpal tunnel, at least initially, in this kind of setting, is going to be something that is treatable with some mechanical measures, with splints, with some stretching kinds of exercises. So, to some degree, our job is to keep them away from you.
That's right.
And to send them to you.
Well, I think that's a good point. The job of every primary care institution and the job of medicine in general should be to put surgeons out of business.
Exactly.
Right.
We are the only profession that is continually trying to put ourselves out of business.
Right. That's the perfect answer. If there's a pill that can get rid of every disease that I now treat with a scalpel, that's perfect. Because there's no disease in the world that can't be made worse with a scalpel. Right?
Absolutely.
There's complications in surgery only if you do the surgery. So if you can treat people without surgery, which is a strong emphasis in my practice, very strong emphasis in your practice, and throughout the Boice-Willis Clinic because of their high quality driven nature, then truth be told, you deliver better medicine.
Absolutely.
Right?
If someone right after having a baby has feelings, gets bloated, gets short of breath or whatnot, that can be an emergency situation though. And I say that because my daughter-in-law almost died with throwing clots and kidney failure. And so if people, I'm sure the OBGYNs tell them that, but the tingling a while afterwards is not symptoms of that type of thing, but we need to be sure that if people are having severe problems right after giving birth, they need to either get to the ED or call somebody who's going to tell them to go there pretty quickly because it can be severe.
Yeah.
Agreed.
A sudden onset of any pain or any shortness of breath is an emergency until proven otherwise. And blood clots are the surgeon's biggest fear. It's should be something that's recognized by the general public as a leading cause of death and disability in our country. So, and it often happens after surgery or any change in your physiology,
Or when
after
flying.
anesthesia.
Because I just flew, and I did what you told me. I took some aspirin
Right?
before flying because I sat for six hours straight.
Keep your muscles moving.
And I moved my feet, and you got up periodically and whatnot, because it's not good for any of us to be stationary
Oh,
like that
I
for 6
fly
hours.
overseas a lot for mission work, and I irritate everybody on the plane by walking 100 miles up and down the aisles, you know, during the flight,
As you should.
as I should.